All right, guys. Hi. So, we're going to be talking about personality disorders today. And if you hear that in the background, that is thunder. It is thundering outside, but it's okay. All right. So, when we talk about personality disorders, this is kind of interesting. ATI defines what a personality is. So, according to ATI, personality refers to the unique blend of traits, thoughts, attitudes, and the behaviors that make a person unique. And so, personality is essentially what makes up a person. Okay. Um, this is just a couple of background information, so sit back and relax as I just talk to you about some of the background information. Um, there is a five-factor model of personality theories that a personality is framed by five sets of domains called the Big Five. We have extroversion, agreeableness, conscientiousness, neuroticism, and open to experiences. So, extroversion is the engagement of a large brotherif. Oof, I can't say that word. Of activities rather than deep. People who are extroverts enjoy interacting with others and gain energy from social situations. Agreeableness is a desire for social harmony. People who are agreeable get along well with others and are generally kind and trustworthy. Conscientiousness. This is a predisposition for self discipline and duty. People who are conscientious are focused and regulate their impulses. Neuroticism is a tendency, neurotism, I don't know, is a tendency to experience negative emotions. People who tend to be neurotic have low emotional stability. And open to new experiences is a general appreciation for experience, including art, emotion, and imagination. People who are open to experience are curious and willingness to try new things. So, according to ATI, because it doesn't say who's a theorist for this, but according to ATI, we'll say all of these things are what make up a person's personality. Okay? So, when we talk about personality development, we go back to Erikson's eight stages of development. Okay, we talk about Erikson's 8 stages of development. When they meet a developmental task, I'll say, then they have met that and they can move on. Okay. If somebody has not met that developmental task, a lot of times people get stuck in that and it becomes a domino effect for people being stuck in that for maybe the rest of their lives. If they do have good good coping skills, they can maybe prevent some of these things from happening. But a lot of times, people will stay in and not meet certain emotional developments and not able to develop a task. Okay, so for instance, I'm sure that was a lot. So let's talk about 0 to 1.5. We've got Erikson's trust versus mistrust. What is a developmental test? What are they supposed to be doing? What's their job during that time? Well, their job is essentially to form a bond with the primary caregiver as a foundation of trust in others later in life. Okay? But what happens if they were abandoned? What happens if they cry and cry and cry and nobody comes to their rescue? What happens if they get put into the system and the system, doesn't, treat them well? What happens when that trust is broken? They develop mistrust. Okay. And if at 1.5 years old they have not gained trust, they gain mistrust, then they may have difficulties in the next stage of development, which this is 1.5 to 3 years old, is autonomy versus shame. Autonomy is doing things by themselves, being independent. Shame would not having self-control, maybe being more dependent. And so if you have somebody who didn't get a lot of trust and they had mistrust and they went on to be a 2-year-old who, everything is being done, or nothing, they're not able to have any independence. They feel like they have a loss of their control. They may have this shame, and they may not reach some of their developmental milestones like they're supposed to, and they may fall back, okay? And then so on and so on, we can start to have just a decline in the the personality, I'll say. And so please make sure that you have a general understanding of the Erikson's developmental stages. I'll test you on a couple of them, so just have a basis of understanding of them. We have talked about them before, so this should not be new. So personality disorders are not usually diagnosed in children. A personality is fluid in children, and they are learning to adapt to when life changes. However, as the client ages and exhibits odd, dramatic, or anxious behaviors that create dysfunction in their lives, differential diagnosis is possible. And so it is appropriate for us to say that per DSM and the evidence that children are not diagnosed with personality disorders. But patients can have differential diagnosis. They can have traits, okay? And so we can look at this right here. We look at this little boy or child. I guess you can't tell if it's a little boy or girl. But for children, personality develops based on temperament and interactions with the environment. Disorders can impede development, and problems with school may occur. In young adulthood, if a young adult develops a personality disorder, keeping a job and maintaining relationships may be difficult. And we talk about older adults who have personality disorders may become more dysfunctional with retirement from work. Okay, and so once they retire from work, they're going to have more of decreased functioning. Okay, so this is where it gets a little tricky. So when we talk about the personality disorders, there are 10 personality disorders, and they are broken up into clusters, 3 clusters. So you have cluster A consists of 3 personality disorders that are characterized by odd or eccentric behavior. Okay, so we have paranoid personality disorder, schizoid, and schizotypal personality disorder. Then we have cluster B. Cluster B is 4 personality disorders, and they are characterized by dramatic, erratic, and emotional behavior. Okay, so I'm going to go ahead and highlight this in just another color. And for cluster B, we've got antisocial, borderline, histrionic, and narcissistic. And then we have cluster C. Cluster C consists of 3 personality disorders that are characterized by anxious and fearful behavior, and they are avoidant personality disorder, dependent, and obsessive compulsive personality disorder, which is different from obsessive compulsive disorder. Okay, so we have 10 personality disorders, and of those 10 personality disorders, they are broken up into clusters. Cluster A, cluster B, and cluster C. Okay? Okay, and we'll talk about those personality disorders in just a little bit. Now, when we talk about personality disorders, they do persist through the person's lifespan, and they can present many challenges for the patient. Okay? For children, it may be difficult for them to make friends or be successful. Adolescents who have personality disorders may find that their peers will tense up for them having odd habits, ideas, or behaviors. And then for adults, they may have trouble with forming intimate relationships, keeping a job for an extended amount of time. If they have paranoia, they may have difficulty with trusting others. They may lose jobs. They have obsessive compulsive traits. They also may have maladaptive ways to treat these traits, okay? Now we're talking about treatment. How are these personalities treated? So let's just think about this. If a personality disorder is part of someone's personality, can you medicate someone's personality? No, you cannot. You cannot medicate someone's personality. No. the person has like a lot of rage, aggression, whatever, you can treat that. But we really can't treat a personality, okay? So our gold standard or first line treatment for personality disorder is cognitive behavioral therapy, dialectical behavioral therapy, and interpersonal therapy, okay? If the patient does need to take medications, they can take antidepressants, mood stabilizers, antipsychotics, are also used in conjunction with, so in adjunct with cognitive behavioral therapy. Dialectical behavioral therapy is also another great treatment plan for personality disorder, patients with personality disorders, and interpersonal therapy. And we'll go through these case studies while we're in class. All right, so I'm not really going to go ahead and talk about these comorbidities too much, but people that have personality disorders is typically accompanied by one or more personalities or one or more comorbidities. So greater risk for impaired functional skills, higher rates of employment, unemployment, or homelessness, higher rates of relapse, poor prognosis, poor adherence to treatment regimen, and increased risk for suicide, abuse, and traumatic experiences. You can go ahead and on your own look at the comorbidities within the clusters. I'm not going to review this and it won't be on your exam. I'm not 100% sure if it's on your proctor, so you just may want to just like gently review this if you need to. Okay. When we talk about risk factors, this is along where our ACEs comes into play, so our adverse childhood experiences. But a lot of risk factors can be genetic and it can be environmental, just like essentially everything else. But risk factors are typically going to include emotional, physical, emotional, verbal, and sexual abuse, neglect, and hostility. Okay. We're not really sure the etiology behind personality disorders, but theorists do suggest that there is some sort of psychological, psychobiological, and genetic contributions, but a lot of times it can be like an environmental or an environmental factor. Okay. The diastasis stress model theorizes that everyone possesses a genetic or biological vulnerability to certain illnesses such as personality disorders, and experiences to triggers and vulnerability and stress can also increase the risk for personality disorders, but alas, it is just a theory, okay? Okay, so now let's go ahead and dive on into the personality disorders, and I will go ahead and change the color of the highlight so it can be cohesive. Okay, so the first one we're going to talk about are cluster A. Okay, so when we talk about cluster A personalities often demonstrate odd or eccentric behaviors. This includes paranoid personality disorder, schizoid personality disorder, or schizotypal personality disorder. Okay, and I found this really cool thing right here on Instagram that is a little helpful mental health mnemonics that can be really helpful when you're studying and trying to remember these. So cluster A, we're going to think, I guess it says we're going to think mad. I don't know. But patients seem odd, eccentric, withdrawn, familial associations associated with psychotic disorders. Okay. And so paranoid, they think suspect, suspicious of others, unforgiving, infidelity, perceived attack on character, enemies or friends, confiding in others is feared, and then threats interpreted by in benign remarks. Schizoid, think distant, detached, flat, indifferent, sexual experiences of little interest, tasked on solidarity, absence of close friends, neither desires or enjoys close friends, and takes pleasure in few activities. Okay, so we're thinking of paranoid. These people are just like every little thing, they're out to get me. Okay, every little thing. Hi, how are you? Why do you want to know how I am? How are you? Or, why did he ask us how I... It's just very suspicious, okay? Schizoid personality disorder. You can think of like a basement dweller. in the dark, doesn't want to do anything, constantly, in the dark, doesn't want to do anything, doesn't want to have any friends, doesn't want to go anywhere, very flat affect, emotionally cold. Okay. I would think of, would Wednesday Addams be a good schizoid personality disorder? Maybe. I don't know. Yeah. I think she does like to do things all by herself. She's like 10, so we're not going to talk about that much. She's a flat affect, cold, indifferent to praise and criticism. She doesn't have any friends. Um, does not desire to have friends and takes pleasure in few activities, right? So let's say Wednesday Addams. And then schizotypal. So schizotypal, we're going to think me peculiar. Okay, so schizotypal, they're going to have magical thinking, experiences unusual perceptions, paranoid ideation, eccentric behavior, constricted or inappropriate affect, unusual thinking, speech, lacks close friends, ideas of reference, anxiety in social situations. And we're going to rule out psychotic or persuasive developmental disorders, but you don't have to pay attention to that. So when we're looking at schizotypal personality disorder, these people are people that like everything is magical and beautiful and wonderful, and oh my god, it's 807. 807 is such a magical number because if you add this and this together, if you add 2 and 7 together, you get 9, and 9 is such a beautiful, round, magical number. And everything is just, witches and wonderful and fairies and, blah, blah, blah. These people may have very eccentric behavior or appearance. They may, dress very differently. They may experience unusual perceptions to things. Like I was saying, it's 8 o'clock, and 8 o'clock is just like a beautiful, magical time of the day or whatever. These people really want to have close friends, okay? But people think they're a little weird, so they don't want to hang out with them. They think they're a little odd, so they're like, I'm good. And so that would be our schizotypal. And this is our cluster A, okay? So we talked about paranoid. We talked about schizoid. And then we talked about schizotypal, okay? All right, so now we're going to go move head on and move to cluster B. So clients who have cluster B personality disorder are typically erratic, emotional, and very dramatic, okay? The personality disorders include antisocial personality disorder, borderline, histrionic, and narcissistic. If anybody has ever seen the TV show Ginny and Georgia, Georgia is cluster B. She's got a lot of the different little traits, okay? I wouldn't say that she actually has any of these because she does show emotion, and she shows remorse. So for her, I would say that she has like a complex like PTSD with cluster B traits. But I wouldn't say that she has any of the cluster Bs, but we can talk about them. So we're going to go back to this super cute little Instagram thing. And when we think of cluster B, we're going to think of bad. Okay, these people seem dramatic and emotionally inconsistent, and they're very familiar with mood disorders, okay? And so when we're thinking about mood, okay, these people have lots of like varieties of mood, whether it's like angry or upset or they're just like very feely people, okay? So when we talk about narcissistic, think of grandiose. So they're grandiose. They require excessive admiration. They're arrogant. Their needs are special and associated with other people. They have dreams of unlimited success, power, beauty, love, interpersonal explosiveness. Others' feelings are not recognized, so they lack empathy. Sense of entitlement and envisions or believes others are envious of them, okay? So we think about narcissism. Oh my God, who would we think of? I say we think of like, I say maybe like Ursula, right? I think Ursula would be narcissistic. I think Yzma, if anybody's ever seen Emperor's New Groove, I have toddlers, and so this is why I'm only thinking of Disney TVs. But try to think of somebody who's narcissistic, bring it into class, okay? And so when we talk about grandiose, I am beautiful, I am amazing, nobody can touch me, arrogant, oh my God, like I am the smartest person ever. Um, and I am beautiful and I am powerful and I don't really care what anybody thinks. I'm like the best person ever. This is narcissistic. Okay. All right. So now we're going to move on to histrionic. Histrionic, think actress. Okay. These people are theatrical. They're the center of attention and they're very easily influenced. They have seductive behaviors, relationships believed to be more intimate than they actually are. They have shallow expression of emotion that rapidly shifts, and their speech is impressionist and vague. Okay, so when I think of histrionic, I think of an influencer. So influencers are very, very theatrical. They like to be the center of attention. They appearance is used to attract attention. So they may have this, like, if they are a male that is like super buff, they may like not wear a shirt and wear teeny tiny like speedo pants thingies. If they're a gal, they may have like their chest open. They may have like gaudy makeup. And they're just very, just like perfect. Like everything is perfect. Everything is amazing. Oh my gosh, it's great. And meanwhile, like it's a dumpster fire really in the background. Okay, that's our histrionic. Then we have borderline. So let's go ahead and we're going to look at, for borderline, I am going to look into the DSM just to help you guys out a little bit more. So when you look at borderline is a little interesting because patients that have borderline personality disorder often experience poor boundaries between them and others. They have excessive emotional reactions, fear of abandonment, and impulsivity amongst many other manifestations, okay? So when we talk about borderline, the biggest thing with a borderline patient is safety is a huge concern, okay? Because most of their manifestations involve self-harm or having an attempt or threatening suicide, okay? They have lots and lots and lots of, if you leave me, I'm going to harm myself so you can stay with me. They have a fear of abandonment. This is huge for them. And when that abandonment starts to rear its ugly head, they're going to have impulsivity to distort what's going to happen, to distort the abandonment, to bring people back to them. And it is very intense, okay? According to ATI or Foxhall, Hamilton, Gyrist, and Button, it is believed that origins of borderline personality begin with a sensitivity to rejection in childhood, okay? Additionally, exposure to traumatic events in childhood increases the chance of developing this disorder. When we're talking about borderline personality disorder, abandonment is real. They have very unstable and intense interpersonal relationships. They have marketable, unstable self image. They're very impulsive. Lots of the impulsivity is self damaging. And they have recurrent suicidal behaviors, gestures, threats, and mutilating behaviors, okay? They do have intense emotions that can last a few days or a few hours. And they're chronically just empty. They're chronically trying to fill a hole and have an inappropriate, intense anger or difficulty in controlling their anger. So these people may have like constant fights and they be constantly arguing, constantly having frequent displays of temper. And a lot of this is transient stress related paranoid ideation or severe dissociative symptoms, okay? And so we can look at this right here to kind of like simplify it a little bit. When we think of borderline, we can think of impulsive, okay? So impulsivity. They also have potentially self-damaging ways. They have mood instability, paranoia, unstable self-image, labile, intense relationships, suicidal gestures or self-harm, inappropriate anger, avoiding abandonment, and emptiness, okay? And so when we talk about borderline personality disorder, the biggest treatment for this is dialectical behavioral therapy. Now, dialectical behavioral therapy is used to improve clients' coping skills, to improve impulse control and affect lability. Okay, and we'll talk about this a little bit more in class. Okay. Patients can also have narrative therapy, which deconstructs and reauthors personal stories. And this is also very, very helpful with patients as well. Okay. And so we'll talk a little bit more about these in class as well. Medications are also typically given to help treat the anxiety, emotional dysregulation, and some of the psychotic features like paranoia that are present with this disorder. Okay. All right, and now we have, so histrionic, narcissistic we talked about, and then now we talk about, oh wait, there's one more. Antisocial, let me find it. Antisocial. Antisocial. So when we talk about antisocial personality disorder, we kind of want to think about a serial killer. Okay, so serial killers are typically antisocial. So what is antisocial? So these folks tend to disregard and violate the rights of other people and dismiss the rules of society. The predominant feature is lying, deception, aggression, avoiding laws, reckless disregard for safety of self or others, irresponsibility, and the total lack of remorse. Now, what does lack of remorse mean? If I were to drive, I've never hit an animal before, but if I would have ever hit an animal like a squirrel while I'm driving, I would be distraught. Okay? I would be so sad. Okay? Patients with antisocial personality disorder, they hit a squirrel, one less squirrel that's roaming around. Okay? That is lack of remorse. I lied to you. Some people, if they lie to somebody, they kind of feel a little bad about it. Antisocial, I lie to you. Oh well. Okay. It is believed that there is a genetic contribution to these behaviors, but dysregulation of serotonin, which seems to always be a default for psychology, contributes to low arousal, poor fear conditioning, and deficits in decision making. So we can go ahead and look at this right here. So antisocial cannot, you can say corrupt. Oh my God, these are so good mnemonics. So corrupt, can't conform to law, obligations ignored, recklessness, disregard for safety, remorseless, underhanded, so they're deceitful, planning insufficient, impulsivity, and temper, irritable, and aggressive. Okay, so that is our cluster B. Let's see what times we got. Oh, we're doing good on time. Okay, so now we're going to move on to cluster C. So when we talk about cluster C tends to exhibit anxious and fearful behaviors, okay? Try not to confuse paranoid with anxious and fever. Not fever. Try not to confuse anxious and fearful behaviors, okay? So when we're talking about cluster C, let's see what this little thing says. Cluster C is sad. Patient seems anxious and fearful, familial associations with anxiety disorders, okay? So we talk about these. We've got avoidant personality disorder, dependent personality disorder, and obsessive compulsive personality disorder. Okay, so this is different from our obsessive compulsive disorder that we had in anxiety. So a client that has avoidant personality disorder may lack close friends, social activities, fear of criticism, and feels anxious or embarrassed while in front of other people. Okay, this can hamper successful achievements because the patient avoids responsibility to prevent criticism from others. And this is kind of like all of the DSM criteria for it. If we're going to look at our little cheat sheet over here, our little fun mnemonics that are helpful, this is cluster C. And please, guys, if you need to, please go ahead and take a picture. So I'll go back here, take a picture of this, and you can always, go back. Take a picture. Take a picture. Take a picture. Take a picture. All right, so now we're under cluster C, avoidant, cringes, okay? So criticism, restraint, and relationship due to fear of being shamed. Inhabited, I'm not saying that word right, I don't know why, but in new relationships, inhibited in new relationships, needs to be sure of being liked before engaging socially, gets around occupational activities requiring interpersonal contact, embarrassed, prevents new activities such as taking risk, and self-viewed as socially input and appealing or unappealing or inferior. Okay, and so avoidant, let's see, who would be avoidant? We pick on Piglet a lot from the 100 Acre Woods, but Piglet would be giving like avoidant. Like Piglet don't want to do nothing, right? Piglet would be certainly avoidant. I don't know who else would be avoidant. If I can think of anybody else, I don't know. But bring it to class so we can talk about it. All right, so the next one we have is dependent. So dependent personality disorder is an excessive and also a persuasive need to be taken care of with behaviors such as clinging, having excessive fear of separation, okay? And so when we're talking about these folks, they exhibit very submissive behaviors and often have difficulties making decisions without guidance. They need reassurance and they're dependent on others for responsibility for major areas of their life, okay? They have unrealistic fears about their ability to care for themselves, lack of confidence, may go to excessive lengths to obtain nurturance. So when we're talking about dependent personality disorders, these folks are dependent on somebody for everything that they need. Everything. So I think this is reliance is the word for dependent for this. And before we do that, let me see characters of personality disorders. Real life. Real. Let's see. Real. Oh, let's see. Let's do Disney. Because everybody's seen a Disney movie, right? All right, let's see here. Which we got here? This is Pinterest. So Pinterest says that Pinterest says that Jafar is schizotypal, but we're looking for a dependent, right? Snow White, dependent personality. She would be dependent personality disorder because she can't make a decision without them dwarves. She got to have their sense in everything. That would be perfect. So Snow White, dependent personality disorder. Let's see what else. We're looking at the 100 Acre Woods. Let's see. Movie. We can see TV characters. Oh, this doesn't give us TV characters. All right, I'm not going to bore you with this. I'll look at this up on my own. Okay, so we've got dependent personality disorder. They cannot make no decisions on their own. Nothing. All right, obsessive compulsive personality disorder. So, a client who has obsessive personality compulsive disorder often has an intense obsessive thoughts that are relived by compulsive ritualistic behaviors, okay? These clients who have this disorder are perfectionists, demand control, they have a lack of flexibility, and are reluctant to delegate tasks to others. So when we're talking about obsessive compulsive personality disorders, these are persons that has intense obsessive thoughts, and they also have ritualized compulsive behaviors, but they're also perfectionists. They demand control, they have lack of flexibility, and reluctant to delegate tasks to others, okay? They feel a need for control but are often unaware of their personality disorder, meaning they have these things that they have to do, but they're typically unaware. Okay, so when you talk about obsessive compulsive disorder, OCD, they are aware, right? They're aware of their compulsions. Obsessive compulsive disorder, personality disorder, unaware. Unaware. Okay, so that's how you can kind of differentiate between the two, aware and lack of awareness. All right, so I'm going to highlight that in pink. So when we're talking about criteria, preoccupied with details, rules, lists, orders, organization, schedules, shows perfectionism, excessively devoted to work. This is our workaholics, to the exclusion of leisure activities and friendships, over conscientious and scrupulous and inflexible about matters or morality, ethics, or values, unable to discard wore out or worthless objects even when they have no sentimental value, reluctant to delegate tasks, adopts a misery spending style towards self and others. Money is viewed as something to be hoarded or for future catastrophes. Maybe these are also our disaster planners too, right? And shows rigidity and stubbornness. Okay, so let's see what our gal has said over here. Obsessive compulsives. Scrumpter? I don't know what that says. Scrumpter? I don't know. But stubborn, cannot disregard worthless objects, rules/detailed obsessed, inflexible with moral ethics or values, miserly, perfectionist, excludes leisure due to devoted to work, and reluctant to delegate tasks to others. Verbatim, right? And then let's see, who can we say that has obsessive compulsive disorder? We could say that it is, the rabbit. Well, this is obsessive compulsive personality disorder, so that would be a little different. They don't have it on here. So really good person that you can say that you can kind of remember, Monica from Friends. So Monica from Friends, how many towels did she have in her closet? She had like 17 towels. She was very rigid. Nobody could eat in the rooms, and crumb was just like awful. I remember Phoebe had left like her fingernail in her pie, and Monica like almost blew a gasket. Although I don't know, that would be that would be something that I would probably get really mad at too. But she's aware that she is very rigid, but she doesn't feel like that there's a problem with that. Okay. She wouldn't also have OCPD or obsessive compulsive personality disorder because she is able to maintain her friendship. She has work-life balance. She has a husband. But the traits that she has would be synonymous of. Okay. So that is their clinical, presentation for those. We already talked about treatment. Collaboration, we can work closely with counselors, psychologists, psychiatrists, advanced nurse practitioners, art therapists, yoga instructors, musical therapists, other people to help with treatment. I am going to post this cluster review for you guys, just to help you with understanding. And we'll work on this together in class. Okay, so when we're talking about client-centered care, it's really, really important that when we're talking about manifestations of personality disorders, this may affect the ability for them to have like long-standing relationships with people. Okay, some may not have friends. Some behaviors that they may have can be impulsive, which puts their intense risk for safety. And patients that have antisocial personality disorder may be very dismissive of rules that in regard to like safety. Okay, so when we're talking about caring for these clients, we need to make sure safety is a priority, and we also need to make sure that we are very empathetic and sensitive to these patients. We already talked about how adverse childhood experiences could affect these patients, and so it's going to be really, really important that as nursing, we're using trauma-based nursing to, just communicate with our patients. And then when we're talking about a therapeutic presence, we really need to make sure that we're understanding how we can help these patients. So for patients that have cluster A, we can be very empathetic, help the client process through feelings and emotions that they can't share with others. For cluster B, we can help the client with processing their needs by setting boundaries and model good communication for them. And for cluster C, these are personality disorders that are a little bit more like sadder. We can go ahead and suggest anxiety, coping skills to empower the patient. Okay, and so these are really, really, really helpful. Again, when we're talking about communication, we need to make sure that we are doing our best to make sure that in documentation, we're sharing very when we're talking to our patients, we are documenting anything that was done with our patients and collaborating with other team members. And using different things to help. You can go ahead and review the nursing process on your own. We will talk a little bit about this in class, but please make sure that you go ahead and review this on your own, okay? Here is a care planning by personal care cluster. So for cluster A, we're finding and maintaining interpersonal relationships. Cluster B, safety and maintaining appropriate boundaries is going to be big. And for cluster C, decreasing anxiety. And here it is again, which is really, really helpful. All right, and then that is about it for this. I think that that is it. So I hope that this was really helpful. The personality disorders can be a little tricky. I will find a couple of mnemonics to help you guys, but I hope this was really good. I know it was a little bit longer than expected, but it came with a lot of really good information. So I really hope that it was helpful. All right, happy studying, guys.